Hi, my name is Tracey Shors. I'm a distinguished professor in the Department of Psychology in the area of Behavioral and Systems Neuroscience. So I want to talk today about a study I've been doing with the Brain Health Institute. I'm interested in trauma and how trauma affects the brain and how we can help people recover from some of the responses to trauma. I developed an intervention known as MAP Train My Brain. This intervention combines mental and physical training. The mental training is a form of meditation known as focused attention meditation, where you focus your attention on one thing at a time. We focus our attention on our breath. The meditation is followed immediately by physical training with aerobic exercise. And by aerobic means oxygen. So that means getting the heart rate up above about 120 beats per minute. So each session of MAP training is 30 minutes of meditation followed by 30 minutes of aerobic exercise. And we found in numerous studies that these two procedures, when done together, really help people with trauma, anxiety, depression. In the study I want to talk about today, we provided this intervention to women who had sexual violence while they were in college. They were all experiencing lots of symptoms of PTSD, post-traumatic stress disorder. In fact, most all of them met criteria for a diagnosis of PTSD before training. They also had symptoms of rumination, so they're thinking a lot repetitively about the past. They had symptoms of depression and anxiety. After training, they did this program twice a week for 6 weeks through an online video. Their symptoms of PTSD decreased by 40%, which is pretty astounding change. Many were no longer met criteria for a diagnosis of PTSD. They were ruminating less anxiety, less depression. These data suggest that just engaging in these activities that are pretty accessible to all of us can be really beneficial for our brain health. May happens to be Mental Health Awareness Month, so we thought this would be like a good example of how you can take research from the laboratory. I developed this intervention somewhat based on studies I did on neurogenesis some years ago in preclinical studies, and translated some of that information into this intervention that actually, helps people, particularly women who've experienced sexual violence. It's also a good time to think about our own mental health. That some of these are tools that all of us can use to help us, not only for traumas that happened in the past, but the traumas that are still yet to come. And in the meantime, I do want to thank the people who actually did the work. Esther Bennett, she's a graduate student in social work. I'd like to thank Emma Millen. She was my doctoral student at Rutgers. And I'd like to thank David Zald from the BHI. He's been helping us a lot with the imaging. We also scan the brains before and after training. We're still analyzing that data. And thank you for your attention. Take care of your brain.